Well, there's often a disconnect between research and policy. We often think about the importance of research into practice, where there also are sometimes, or too often, gaps. Policy is a powerful lever to try to help shape practice and to ensure that we guard against unethical behavior, that we encourage effective and efficient strategies in healthcare, that we promote the best interests of the public and patients first and foremost. And what's really important is that we start thinking about how can we ensure that research has a straight path into that process, that policy process, because oftentimes the people who are developing policy are sort of isolated from the researchers, and they are getting their information anecdotally or through sound bites in different directions, but aren't being able to interact with the people who are doing the research. And the people doing the research aren't often tuned into some of the constraints that policymakers face and the kind of knowledge that could be useful to them. I really believe that in the future we need to bridge this gap. We need to get researchers more attuned to the kind of realities that policymakers face and the opportunities that exist within policy and the promise that policy may hold for improving the status quo. And on the other hand, we have to get policymakers more in tune with understanding what the importance is of the quality of the studies that are done, not just seeking to find any study that may be supporting a particular agenda, but understanding underlying it, the strength of that evidence, how well it was being done, and what messages can be taken from it, and what kind of limitations there may be on those studies. Because too often on the policy side, people are just looking for something that supports their position, as opposed to trying to bring people together, understand deeply what the science can tell us, and then try to construct policies appropriately. There's one other point here that's important, which is that in the course of implementing policy, it's also important for scientists to be involved in evaluating the effects, because even the most well-intended policies can have unintended, ill-advised consequences. And unless we have put into place surveillance, monitoring, ways for us to evaluate the success of policies which seem potentially so promising at their inception, to see whether they've fulfilled their promise, we'll never know. And even if we're causing harm, we could never know. So even going back the other way, policy to research, we need to be able to build these bridges so that the policies initially being built on the strongest possible evidence, and once implemented, we are using science to evaluate their impact as we continue to refine and iterate them over time.